Many people survive their first heart attack but don't make it through the second. Yet one simple change in your weekly meals can significantly lower the risk of sudden death from blocked coronary arteries. It's not a drug and it's not an expensive treatment. It's a familiar food that's easy to find and prepare. Did you know there's a group of fish that contain a special type of fat proven to fight chronic inflammation, improve blood lipids, and prevent blood clots in the arteries? The problem is that not everyone eats the right kind of fish, prepares it the right way, or consumes the right amount to actually protect the heart. So, what exactly can omega-3s from fish do? Which fish should you eat and which ones should you avoid? How much is enough to make a real difference? And what happens if you cook it the wrong way or choose the wrong source? This video will answer all of these questions so you don't miss the chance to prevent your next heart attack in a simple but powerful way. Fatty fish are a natural source of high levels of omega-3 fatty acids, primarily in the forms of EPA and DHA. These are essential compounds that directly influence several biological processes involved in the development and progression of heart attacks. First, omega-3s have powerful anti-inflammatory effects. Chronic low-grade inflammation in the endothelial lining of blood vessels is a key trigger for plaque buildup, which narrows the arteries and increases the risk of blockage. EPA and DHA help suppress inflammatory cytokines, reduce platelet activation, and stabilize the endothelium, which can slow or even reverse the progression of atherosclerosis. Second, omega-3s have a significant impact on blood lipid levels. They lower triglycerides, an independent risk factor for heart disease. Some studies also show that omega-3s can modestly raise HDL, the good cholesterol, while reducing the number of small, dense LDL particles, which are more likely to stick to artery walls. In addition, omega-3s help lower resting heart rate, stabilize cardiac electrical activity, and reduce the risk of arrhythmias such as atrial fibrillation and premature beats, which are known to increase the risk of clot formation inside the heart and stroke. Finally, omega-3s improve endothelial function and may slightly lower blood pressure in individuals with mildly elevated levels. Together, these mechanisms provide broad cardiovascular protection from the coronary arteries to the small blood vessels in the brain and peripheral circulation. It's important to note that these benefits only occur when omega-3s are consumed consistently from natural food sources, especially clean, uncontaminated fatty fish. Not all types of fish contain the same levels of omega-3. Certain species are classified as fatty fish, providing significantly higher amounts of EPA and DHA, which are proven to help prevent heart attacks and reduce the risk of stroke. The following are 6 of the best fatty fish to include in your diet at least twice a week to support heart health. First is salmon. It is one of the richest and most consistent sources of omega-3, offering about 1.8 to 2.5 grams of EPA and DHA per 100 gram serving. Salmon also provides easily digestible protein, vitamin D, and selenium, which help reduce inflammation, support immune function, and maintain vascular health. Wild-caught salmon generally has higher omega-3 content and lower antibiotic exposure compared to farmed salmon. Second is Atlantic mackerel. This fatty fish contains approximately 1.0 to 1.5 grams of EPA and DHA per serving. It also provides natural coenzyme Q10 and various B vitamins that support heart function and cellular metabolism in heart muscle. It is important to distinguish Atlantic mackerel from king mackerel, which may carry higher levels of mercury. Third is sardines. Though small in size, sardines are packed with omega-3, averaging around 1.0 gram per 100 grams. Due to their short life cycle and simple food chain, sardines have lower heavy metal content. They are also a good source of calcium, vitamin B12, and vitamin D, making them ideal for older adults with both cardiovascular risk and bone health concerns. Fourth is herring. This fatty fish is popular in Northern Europe and is high in omega-3 as well as vitamin D and selenium. Lightly pickled or fermented herring is commonly consumed in Scandinavian heart protective diets. However, herring packed in oil or heavily salted should be avoided due to excess sodium. Fifth is anchovies. Often used in fish sauce or anchovy paste, these small fish are surprisingly rich in EPA and DHA. Because they reproduce quickly and live near shore, anchovies have a low risk of heavy metal contamination, making them a safe option for older adults and women. If consuming dried or salted anchovies, rinse thoroughly to limit sodium intake. Lastly, tuna. Fresh tuna or canned tuna in water contains significant amounts of omega-3, particularly varieties like skipjack or albacore. However, because tuna are deep-sea fish with longer food chains, they may carry mercury, especially in larger species. People with liver or kidney issues should limit tuna and rotate it with smaller fatty fish to reduce the risk of heavy metal buildup. Choosing the right types of fish and ensuring they come from clean sources helps adults over 50 maximize the heart protective benefits of omega-3s while avoiding potential harm from seafood contaminants. The heart protective benefits of fatty fish only become effective when consumed consistently and in the right amounts. According to the American Heart Association, adults should eat at least 2 servings of fatty fish per week, with each serving being 3 to 4 ounces, or roughly 85 to 115 grams. This intake provides an average of 250 to 500 milligrams of EPA and DHA per day, which is sufficient to maintain normal heart function and reduce the risk of serious cardiovascular events. For individuals with existing heart conditions, such as a history of heart attack, coronary artery disease, atrial fibrillation, or heart failure, omega-3 needs may be higher. In specific cases, doctors may recommend increasing fatty fish intake or using standardized fish oil supplements containing 1,000 to 2,000 milligrams per day. However, food sources remain the preferred method due to the potential risk of overdose or contamination from unregulated fish oil capsules. It is important not to rely on a single type of fish for extended periods, as this may increase the risk of mercury buildup or exposure to environmental pollutants. Instead, rotate between various fatty fish such as salmon, sardines, mackerel, and herring to minimize risks and maintain cardiovascular benefits. Also consider plant-based sources of omega-3 like flax seeds, walnuts, or canola oil, though these contain ALA, which must be converted by the body into EPA and DHA. Maintaining a habit of eating 2 servings of fatty fish per week is a simple, cost-effective, and safe strategy to reduce the risk of recurrent heart attacks, stabilize blood lipids, and improve endothelial function in older adults. This is a practical step that can be implemented directly into daily meals and offers long-term impact on heart health. The way fatty fish is prepared directly affects whether its omega-3 content is preserved or destroyed during cooking. Choosing the wrong method can eliminate the cardiovascular benefits of this food or even cause harm. Studies show that frying fish in oil at high temperatures not only reduces its omega-3 content significantly, but also creates harmful oxidized compounds that damage the vascular endothelium. Deep frying also increases the levels of saturated fat and trans fats, 2 major contributors to atherosclerosis. The ideal methods to retain the nutritional value of fatty fish are steaming, baking at moderate temperatures, or pan-searing without oil. These techniques help preserve the structure of EPA and DHA while avoiding unnecessary fat intake. When baking, it's best to use foil to prevent direct flame contact and reduce the formation of carcinogens, such as heterocyclic amines and polycyclic aromatic hydrocarbons. For steaming or boiling, keep the skin on, as omega-3 is concentrated in the fat just beneath the skin. Some people prefer canned fish for convenience, but it's important to choose those packed in water or olive oil rather than regular vegetable oils. Always check the sodium content on the label, since many canned fish products contain excessive salt, which can be problematic for those with high blood pressure or heart disease. If using frozen fish, thaw it slowly in the refrigerator instead of the microwave to avoid damaging the omega-3s. Avoid using sauces that are high in sugar or sodium when marinating fish, as they can cancel out its anti-inflammatory properties. The best approach is to pair the fish with steamed vegetables or fresh salad and add a few drops of lemon juice or herbs like dill, ginger, or turmeric to enhance flavor and support digestion. These practices ensure that fatty fish becomes a genuinely heart-protective part of the diet, especially for people over 50 looking to prevent heart attacks. In the United States, cardiovascular disease is the leading cause of death, with heart attacks accounting for the largest proportion of serious cardiac events. According to data from the CDC, one American suffers a heart attack every 40 seconds, and this risk increases significantly with age. After age 50, risk factors such as high blood pressure, abnormal lipid levels, insulin resistance, endothelial inflammation, and atherosclerosis all rise sharply, making the heart more vulnerable, even when no obvious symptoms are present. In older adults, the process of atherosclerosis often develops silently over many years and usually doesn't cause pain until a plaque ruptures, triggering a blood clot that completely blocks blood flow to the heart muscle. The result is acute tissue death. If not treated within the first 90 minutes, the risk of death or post-heart attack heart failure is very high. Many individuals are unaware of their high risk because they don't experience the classic chest pain. Instead, they may only feel fatigue, nausea, or mild shortness of breath. This false sense of security often prevents timely preventive action. What's even more concerning is that people who have already suffered a heart attack remain at high risk of recurrence if they don't change their diet and lifestyle. Among the most evidence-based preventive strategies, a diet rich in omega-3 fatty acids from fatty fish stands out. It can reduce the risk of recurrence by 20 to 30% due to its anti-inflammatory effects, lipid regulation, and ability to prevent clot formation. Changing one's diet doesn't just help prevent the first heart attack. It plays a critical role in managing the progression of coronary artery disease, supporting heart function after damage, and reducing the need for long-term medication. People over 50 must understand that the heart cannot fully repair itself after an acute injury. Only through proactive prevention can the serious consequences of cardiovascular disease be avoided. Common mistakes that cancel out the heart benefits of eating fish. Although fatty fish offer well-documented cardiovascular benefits, many people fail to see the expected improvements in heart attack prevention. The main reason lies in common mistakes related to fish selection and preparation, which either degrade the nutritional value or, worse, cause harm to heart health. One of the most serious errors is relying on deep-fried fish as a primary source of omega-3. Frying fish at high temperatures causes rapid oxidation of omega-3 fats and creates free radicals that trigger vascular inflammation and accelerate atherosclerosis. Another mistake is consuming fish that may contain mercury or other heavy metals due to bioaccumulation over time. Large predatory species like swordfish, shark, and certain types of ocean tuna carry a higher risk of contamination. This is especially harmful to older adults, as mercury can impair liver and kidney function and damage the nervous system. When consumed regularly without attention to sourcing, these toxins can accumulate, harming the vascular endothelium and increase stroke risk. Canned fish is another common choice, but it can be high in sodium. A single serving of canned tuna in oil or brine may contain 400 to 500 milligrams of sodium. For someone with heart disease, the total recommended daily intake is only about 1,500 milligrams. Frequent consumption of these products can inadvertently raise blood pressure, one of the most critical risk factors for heart attacks and strokes. Some people also make the mistake of pairing fatty fish with processed sauces that are high in sugar, salt, and preservatives. These additives not only cancel the anti-inflammatory effects of the meal, but also contribute to visceral fat accumulation, metabolic disorders, and insulin resistance. Additionally, relying on unverified omega-3 supplements instead of fresh food is risky. Some of these products contain impurities, oxidized oils, or substandard dosages that fall short of clinical recommendations. To gain the full cardiovascular benefits of fatty fish, adults over 50 need to avoid cooking methods that degrade omega-3s, choose clean and sustainable fish sources, steer clear of contaminated species, and limit canned or salted products. Eating fish only becomes meaningful when it is supported by accurate knowledge and consistent mindful choices at every meal. Linda is a 63-year-old woman living in Arizona. She spent 35 years working as an elementary school teacher and had recently retired. During her annual checkup earlier this year, her results showed elevated LDL cholesterol, triglycerides above the safe range, and signs of low-grade chronic inflammation. While she had never experienced a heart attack, her doctor warned that she was in a high-risk group due to a family history of coronary artery disease. The recommendation was to make dietary changes before considering medication. Instead of adopting a strict or restrictive diet, Linda made just one change. She added salmon and sardines to her dinner twice a week. She prepared the fish by steaming or baking it with leafy greens, adding extra virgin olive oil and natural seasonings like lemon and ginger. After maintaining this routine for 3 months, her blood lipid profile showed significant improvement. Her LDL dropped by 20%, triglycerides returned to a safe range, and her hsCRP inflammation marker also declined. Her doctor considered it a positive development resulting from a targeted anti-inflammatory dietary approach. Beyond improving her cardiovascular health, Linda reported feeling lighter, less fatigued, sleeping more deeply, and losing nearly 11 pounds without engaging in intense exercise. More importantly, she felt in control of her eating habits without needing to deprive herself. When sharing her experience with peers in a local health group, she said her secret wasn't cutting out every favorite food, but simply adding the right, heart-healthy foods in the right places during the week. Linda's story shows that heart attack prevention doesn't have to rely on medication or complex interventions. By consistently following a simple nutritional habit and choosing anti-inflammatory foods like fatty fish, people over 50 can take meaningful steps to manage their risk and protect their heart in a sustainable, evidence-based way. A heart attack doesn't strike out of nowhere. It is the end result of years of chronic inflammation, lipid imbalances, endothelial damage, and a lack of heart protective nutrients. The good news is this process can be slowed down or even reversed if we act early enough, consistently enough, and with the right knowledge. Fatty fish isn't medicine, but it's one of the most powerful foods we have to intervene in the underlying mechanisms that lead to heart attacks. With just 2 servings of properly prepared, carefully chosen fatty fish each week, people over 50 can significantly reduce their risk of sudden cardiac death, lower their long-term dependence on medication, and improve their quality of life. It's a simple, effective, and affordable choice, one that can start with your next meal. But the real benefit only comes when it becomes part of your lifestyle, not just a short-term fix. If you're over 50, have a history of high cholesterol, elevated blood pressure, or a family member who's had a heart attack, make fatty fish a permanent part of your heart health strategy. Your heart doesn't need complex solutions. It just needs timely and proper care. If you found this video helpful, be sure to subscribe to the channel so you don't miss expert-backed, practical guidance on preventing heart attacks and strokes. Your health is the top priority. Don't wait for your heart to send a warning before making a change.